Hi, everyone. With me is Dr. Aditi Tripathi. She is All India Rank 5, AIMS Rank 5, and Common Merit List Rank 7. So, congratulate her for her grand success. And it's a wonderful journey that I hear from her. It's a one story that has pleased me for the day. I would like to listen to that story from her. That's when you actually are thinking of making it go, thinking of quitting it, and then you turn it around into another big story. So that's where Dr. Aditi is. Congratulations, Dr. Aditi.
Thank you so much, sir.
So this means that
Uh,
you're going to get the seat of your choice because AML 5 with 6 seats around, you have
yes, sir.
chance of getting probably both the places, and you are sure to get going to get the seat
Yes,
that
sir.
you want to join. So
Yes, sir.
congratulations. So where are you from, if you can share with your background with our audiences?
Yes, sir. I belong to Uttar
Your
Pradesh, but
undergraduation and post-graduation.
I have done my undergraduation and post-graduation both from VMMC and Safdarjung Hospital, New Delhi. And following that, I did SRship in cardiology there to get a feel of the subject and how it feels to be working in the branch that I like. And once I got that, I joined AIMS Delhi as a SR in medicine, where I did my preparation as well as did some work in the ward and all, so that I did not lose touch completely with medicine while I was at it.
So how was your strategy of preparation? And if you can share your journey as to why I'm calling your story a success story. I mean, uh, I told you before I started the interview, yours is one that
Yes, sir.
is very much appealing in the sense that it gives inspiration to a lot of others. If you can share that journey.
Yes, sir. Actually, feels very nice to be able to be in a position where I can inspire people. Sir, I always wanted to be a cardiologist. It was something that I realized soon after joining medicine. Like even with simple things like reading ECGs or going to the echo lab with patients and looking at them, it would just give me so much interest, so much joy. So wanting to be a cardiologist was something that I knew already. Sir, with regard to preparation, the most important thing is, I think, to go through the videos that are there in the app. So, going through the videos, I made notes, and the notes were my primary source of revision. And with that, I also attempted the question bank. The question bank, the best part about it is that it is instead of a lot of people may disagree with me, but reading the entire Braunwald while we are preparing is not that easy of a job. So I think doing the question bank is kind of like a shortcut towards reading Braunwald, because the explanations and the answers that are given in the question bank, they are directly taken from Braunwald, and they usually take up all the important topics that are going to be asked. So with in that regard, the doing the question bank kind of is like a proxy reading of Braunwald itself, and adding those points which I was not sure of to my notes gave me a gold standard study material. Now, then after that, all that remains is to revise, 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 because the more we read, the more we think we know. But that is where we are wrong, I feel, because every single time I would give a test or I would attempt any question bank, I would realize there are certain things that I've gotten better, but there are certain other things that I'm doing wrong again and again. So I made a notebook, like a special notebook in which I would write these things which are very important or which I make mistakes in a lot, or the things that I know that I will forget. So just before the exam, going through that notebook, it helped me a lot.
So Aditi, can you tell what was the last year's INI outcome for you, and what was the
Ye-
stage that you were
Yes,
going
sir.
through? What did you want to do, and why did you change your mind?
Yes, sir. Sir, last year I got an INI AML rank of 20. And I had been preparing for a while now. I had given a lot of effort to that exam. And to be very honest, I was actually excited for the result. And I was thinking that maybe I'll be able to get like maybe one, two, three, some of these fancy ranks that would help me get a institute of my choice. And when the result came, it was nothing like I had expected, and it just felt like a huge defeat. And it was not a nice place to be in. I'm sure a lot of aspirants can relate to this. So at that point of time, I went to everybody who I could go to for guidance. A lot of people told me that, you know what, just take whatever you're getting. Like, even my parents were of the opinion, take whatever you're getting, take whatever you're getting. And I almost thought of like, okay, fine, let's just get it over with. But then I messaged sir, and then sir was like, what does your heart say? And I told him that I really want to try again. Then sir was like, then one more attempt. And that kind of stuck with me. So that's when I decided. I told my parents that there is one more attempt, my full final attempt that I want to give before calling it quits. And if I don't make it this time, I'm going to accept defeat. So I made that decision to study and give it my 120%, and not just 100%. And I guess there were times where I would think, oh my God, I've gotten myself in a fix. This is so difficult, reading the same thing again and again. And maybe I could have taken the easy way out, this, that. But then I guess in the end, it was all worth it, because I wouldn't be here. I wouldn't be getting interviewed by sir, or, making myself get a seat in my institute of choice if I had given up that last time.
No, I'm glad that you did because I always felt with the disappointment comes the energy, because you, if somebody with rank 20 can celebrate, or somebody with rank 20 will feel down. The extent to which somebody feels let down is what you can convert into motivation and energy. So when you spoke
Yes,
to
sir.
me last time, I could sense that you had this, that you wanted to actually convert that disappointment grudge into an energy or drive to convert it and get it into a seed. And that's why I was like, no, let's give it one more try. I think you have it in you. You will
Yes,
chase
sir.
it even more deadlierly, and that you did, and that's the reason that you're here. And
And
that's the
I am
reason I
so
feel that
grateful
your
for that
story needs to
advice.
go to the other aspirants, how you convert your letdowns as a motivation to kick it off to make it to the next level. So
Yes, sir.
congratulations on that.
Thank you
Uh,
so much,
so
sir.
that so how was your methodology of preparation? You already mentioned about the videos. A lot of times, as you mentioned, some students feel sir the videos are much above Harrison level, but that's the intention here. We don't want to teach you in INI Harrison, because that's already
Yes.
something that you're already prepared, and the questions don't come from pure Harrison. We know that the Q bank is so diverse, the PYQs are so diverse. If you look at the question bank, it's so diverse that unless there is some video which is beyond Harrison, especially from Brunwald or hers, you're not going to actually be able to tackle those questions. So, what was your strategy, Aditi? You would first do the videos and then appear for their questions, or you would first do the questions based on your Harrison preparation and then go back to videos and reattempt. Those are the two strategies most of the students attempt. So, which
Yes,
was your
sir.
strategy?
Sir, the first read, I went through the videos and I made notes, because I realized that I needed some ground material to which I could add and to which I could revise. Now, then later on in the when I tried to revise, then instead of reading the entire thing, I would go do the MCQ, see what I got wrong, revise that point, and add whatever extra was required in my notes, and then add that to my revision. So that it in kind of like, it starts like that, like we need to have a certain set of notes which we have to make. There is no shortcut to that. And once that is made, then we can obviously do questions and then add whatever we need to add to that. So
Right.
for the first
And
read. Mm.
correct. And second read, of course, you go back and visit and rewrite and then reattempt and refine where you're making a mistake, as you already mentioned. You're also part of a couple of WhatsApp groups that I have on
Yes, sir.
learning. So I remember, of course, on one to one, you used to share your doubts and questions. But how is that WhatsApp group interaction aspire for the aspiring students in terms of motivation and also knowledge sharing that you found?
Sir, I think that WhatsApp group is a bundle of knowledge to begin with, because I really appreciate the little snippets that you share from time to time. I remember there was one graph that you had shared, the DBP, SBP, the entire cardiac cycle. I
Oh,
think a
yes.
similar question was asked,
This
exactly
time
the
it was
same
asked.
graph. Yeah, it was
Yes.
asked. They were trying to ask about what is systolic blood pressure, like that. They were asking, and so a lot of questions like they are basics that we forget. We think that okay, we know this, but like it's looking at them regularly. Even the trials that the snippets of the trials are shared on the group that are very helpful. And at the same time, sir, if there is anything that I'm not able to understand, or if any question whose explanation is not very clear, I can always ask and then get a direct answer from the faculty. So that makes preparation very easy. It leaves little room for uncertainty because we getting the answer from the expert themselves. So that whatever doubt, whatever like going back and referring five different books and then getting confused ki is book mein ye likha hai, is book mein ye likha hai. Other than that, I can just directly ask the faculty and get it over with, and that will
Yeah.
save a lot of time.
No, some of those questions actually we get every batch. For example, we know that like a commonest organism, Steph took for infective endocarditis. Harrison mentions differently, Brunwald mentions differently. Every year, one or the other student will point it out and will ask me, "Sir, isme kya likhne ka?" So we know
Yes,
what
sir.
to do. So when you're asking for INI, we'll tell you what to write. When you're asking for NEET, I'll tell you write Harrison. When asking for INI, write Brunwald. That's how you'll have to
Yes,
go.
sir.
That's how the
Yes,
questions
sir.
are usually framed. Okay. Also about the grant tests that you appeared, and how was the overall sense that actually made you feel about the grant test competition? How much did it allow you? All India grant tests that used to happen prior to exams, how were they, and how priming they were in terms of keeping your level to the level of uh, the national level of competition that probably you're preparing for?
Sir, this is, I think, a well-known fact among the aspirants, and I've even spoken to my seniors about this. That the grant is provided by DocTutorials are, I think, the most representative of what is going to be asked in the INI SS exam. And I personally am not somebody who gives a lot of tests, but I made it a point to give at least, if not while it is live, then at least after it's gone off, I would at least attempt the question. So giving the grant test is basically kind of like just assessing yourself in totality. Like usually when we study topics. But the question paper that comes in the exam includes everything. So doing a grant test kind of gives you an idea कि this is the topic where you are lacking. And grant test usually does not consist only of the questions that are there in the question bank. They have different questions. A lot of these questions are based on latest guidelines. A lot of these questions are based on things that are not exactly right there in the question bank. So doing the grant test also gives you an extra edge, and sometimes they also cover the previous year questions. So I feel like doing the grant test in total will give us a good idea of what is lacking and what is to be done right. And again, getting an idea of where you stand with respect to your peers can also guide you. But I am naturally an anxious person, so I wouldn't check my rank even if I did appear for it, because I would just see ki what I got wrong and what I got right, and then focus just on that.
Once you qualified, the preparation for the mock and the final interviews, I think you did pretty great in the interviews as well, Aditi. What
Yes,
was your
sir, I
score out
did.
of 20?
I think I got 20 this time.
Good. So
Yes, sir.
yeah. So I remember last time it was not so great. What was your interview score last time?
So interview score last time was okay only, but the theory I
Yeah.
had messed up. Yeah.
Yeah.
Uh,
So, how was the mocks, and how did you prepare for the interviews? What preparation? I mean, I was interviewing the other students. They would not only go through the mocks that we do just prior to the exam, they would go through the last 3 years mock interviews. And they said
yes,
those
sir.
three recordings are as good as like the whole interviews done, because all the three mocks have very different questions. No question is ever repeated. All of them combined like are like 6 hours, and if you go through those 6 hours of videos, practically everything is covered. Is that correct?
That is very correct, sir. The mock videos are like a rapid fire viva, and which I think is exactly what happened to me in the interview. Like they would just like for to me they just asked like list me the reversible causes of heart failure, 1, 2, 3, 4, go. So I just went on and said, so if you have not prepared, you will be caught in the spot. You're like, oh. even if you know it, you will be not
Yeah,
some, like, you won't be able to speak it properly. So I guess, like, giving the interview, especially the mocks, it kind of gives you a practice to be like in front of a panel and to be able to speak and retrieve the data properly from the back of your mind, because all of us know it, just the purpose, like the way of presentation is what gets the extra marks, I feel.
absolutely, absolutely. You're right. Um, so, how you were full course subscriber for the DocTutorials. So, how do you rate this, the content and the mentor, as a
I think the
specialty
mentor
for you?
deserves, I think the mentor deserves as many stars as there are in the
Okay,
sky.
thank you very
Because
much.
and the material has also been excellent, sir. And it's not just me. I feel all the rank holders which you will be interviewing will agree with me. The material is very exhaustive, and there is one separate section on biostatistics as well, which is a very important topic. I have come to realize after preparing that we don't, Alak say, we don't study, but it is something that is asked profusely, all both in the interview as well as in the exam as well.
Yes, it's
So
going to stay with you in residency as well, and
yes,
it'll
sir.
be something that will distinguish you from the rest of your peer when you get into your practice. That's where you actually can argue on a paper with the author. Somebody who's
Yes,
presenting in the
sir.
conference will stand up and say why it's like this and why it's not like that. So I think
Yes.
it's very important, especially in cardiology. Numbers, the way we talk, is very different than the way it's talked in any other specialty. That's correct.
Yes, sir. Yes, sir.
So,
Um,
final closing words, tips to the aspirants who are looking forward to your interview as to how they should approach if they intend to crack next INISS.
Sir, I feel like the one thing that I'd like to say is to revise, 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 and just keep faith in yourself. I guess I pushed myself to that point where I was like, this is the best I can do. There is nothing else left in any fiber of my body to put forward. And I've given my 100%. And I revised multiple times. I did whatever I could. And I had faith in both God and the universe that, okay, fine, I'll get something. I'll get something, and something that is good for me. I let the universe and the God decide. And so, just to close this interview, I'd say I'd like to thank you. And I'd like to thank my parents and my friends, all who have been there for me as support systems and pillars of support. Especially when I've been so down and doubting myself, they have like, no, you have to think that you're going to get it. There is no other way. You have to remember that you are going to make it. There is no other way. So, very, very grateful for that.
Always a pleasure, and we look forward to hand holding and mentoring you in whichever way I can in future as well as I do for all my students. It's not just the association that ends here; it actually is another beginning. As I say, for most of my students, most of you are always welcome to stay connected
Yes,
and
sir.
reach out to me if there is anything that I can help you all guys out. Best wishes, and this is Dr. Aditri. Let's congratulate her once again, and this is time that you should celebrate and enjoy with your
Yes,
time
sir.
with your family and friends. Best wishes, Aditi.
Thank you, sir. Thank you so much.
Thank you. Good night, everyone. Bye bye.
Good night.